In this video, we are going to learn about appropriate public health response measures in the community post-detection of suspected or confirmed measles and rubella case or outbreak. Key activities of public health response following suspected measles case.
During case investigation of suspected measles case, scan the neighborhood community for identifying any additional unreported suspect cases. If any additional suspect cases are found, investigate them. If 5 or more suspected measles cases are found in a block, ward, or planning unit in the past 4 weeks, or one suspected measles death is found, then flag an outbreak. Preliminary search involving scanning of area has to be conducted within 72 hours of flagging an outbreak to detect clustering of suspected measles cases in the village or mohalla.
If clustering of suspected measles cases is detected,
detailed outbreak investigation needs to be carried out in a planned way, with filling of outbreak investigation form along with sample collection. Additional response measures should be undertaken as per outbreak investigation guidelines. Keep a watch over any additional suspected cases in the area for 1 month from the date of rash onset of last case. If identified, include them in the outbreak investigation. All suspected measles cases should be administered 2 age-appropriate doses of vitamin A. Inform the family regarding isolation of suspected measles case in a 4 days period from rash onset for preventing further spread of infection. Educate parents to remain alert to any common complications and whom to contact in case of complications.
Public health response to confirmed cases or outbreak. Strengthening surveillance.
Strengthening of surveillance should be done through active surveillance, passive surveillance, and health facility contact analysis. An active case search in the neighborhood community should be conducted at the earliest opportunity by the local frontline workers with an intent to cover the entire village or a minimum of 200 households. The purpose is to look for more unreported suspected cases, identify children with complications, and provide age-appropriate doses of vitamin A and referral services to subjects. Alongside, strengthening of passive case surveillance within and outside the existing reporting network should be established. Hence, passive surveillance by tracking the weekly reporting by reporting units H002 and IDSP-P form within the affected block, including zero reporting. All the reporting sites in the area should be alerted about the positive measles or rubella case in the area. All the health facilities in the outbreak or adjoining area should be sensitized and encouraged to report suspected cases of measles immediately. Try to determine if any case has been missed or reporting. Frontline workers to be motivated and resensitized on case detection, its reporting, and also educate family members on importance of isolation of measles cases for at least 4 days following rash onset. It is important to increase awareness of local measles transmission among the local stakeholders. This is to alert them to the outbreak and possibility of further cases. Encourage them to immediately notify suspected cases. Remind them of adequate case management activities, including isolation and infection prevention and control precautions, maintaining the COVID-19 appropriate behavior. While conducting active case search in the community, local practitioners, temple sites, faith healers, and any other local influencers should be sensitized for reporting suspected measles cases. Based on the health facility contact analysis, hospitals or health facilities with potential to report or those which have reported cases but are not part of the network should be included in an evidence-based expansion of the reporting network. Left out and dropouts for the 2 doses of measles rubella vaccine, MRCV1 and MRCV2 should be identified by frontline workers. A list of due beneficiaries in the area should be prepared, and they should be mobilized for the next routine immunization session. Planning for need-based additional routine immunization sessions should be conducted in the area of disease outbreak. The routine immunization microplans of the planning unit and block should be reviewed and updated with information on addition of sessions and communication plans. In case of a confirmed measles case, the parents should be educated about complications such as diarrhea, pneumonia, ear and eye infections. They should also be advised to bring the child to a health center or hospital if any complications are suspected. In case of a confirmed rubella case, pregnant women in the neighborhood should be identified. If the women had the history of similar symptoms during the pregnancy, case should be investigated. Blood samples should be collected. After centrifugation, serum samples should be sent to designated WHO-accredited laboratory in proper cold chain for establishing clarity on suspicion. In case of a pregnant woman with confirmed rubella, local frontline workers should follow the woman until delivery, evaluate the newborn for congenital rubella syndrome, and take up further needful management.